Yes, we're recording.
Thank you. So good morning, everyone. I'm Diane Hagerman with New Jersey Health Initiatives. Before we officially get started, I just wanted to go over a few of the features of Zoom, as Rini said. All of the features are along the bottom of your screen. Starting on the left, you can mute your phone. If you're on video, you can start and stop your video next to that. We won't be using the invite feature, which I'm assuming invites people to join our meeting. The participant icon, if you haven't clicked on that, you can click and see a list of everyone who is on the call on the right side of your screen. There is a share feature that we won't be using today either to share your screen, unless we get into something where you want to do that, but we don't anticipate using that today. There's a chat, so if you click on that, it will also open the chat window on the right side of the screen. We will be using that today to kind of capture some of the answers to the questions, and if anyone else wants to chat in any questions or comments, you can then, at the bottom of the chat, it should be set to send to everyone, or you can click on that and send private messages to individuals within the group. There is also, I think you have a record feature, which we're already recording. There might be an option for reactions, which I don't have, so we're not sure what those are, but feel free to react if you have that option on your screen. And then if you need to leave the meeting, you can click on Leave Meeting. So I think that is all the features. And as you heard, we are recording this call. So with that, I will turn it over to, I think, Anna to just do a quick welcome.
Oh, okay. Hi, my name is Anna D'Elia. I'm with the Council of New Jersey Grantmakers. I believe everybody on the call knows me. I just wanted to welcome everyone to the call. Thank you. This is kind of new for us to do some sort of virtual roundtable where we get together and kind of learn what each other is doing, funding priorities, but we're excited to see how this call goes, and hopefully it's helpful and be something we can continue doing maybe occasionally in the future. So I'll pass it off to Diane and Rini to get us started.
So good morning. As Diane mentioned, Diane and I are co-chairs of the Affinity Group of Health and Aging and the Council of New Jersey Grantmakers. We're really happy everyone is on the call. We haven't had a chance to get together with everyone in person, and we thought we would try this visual method. We have three goals today. One is to catch up and everyone see each other visually as much as we can. Two is to learn and be inspired from each other. I know over the years this has been something that I have found every time we gather. I get excited, I learn from all of you, we get inspired, and we learn to connect offline for peer-to-peer support or advice or suggestions or thoughts about a grantee or otherwise. So I'm hoping we'll learn and be inspired as well from this. And last but not least is to plan the future of this committee and activities of getting together where and priorities. This is really a peer-led group. Diane and I, we're happy to accept the chair as long as everyone else is really an active participant. In the past, for those that are new, some meetings have been held at people's offices or suggested site visits. So as we talk more about what each of you are doing, think about things that are really exciting that you could share with the group as a whole. So without the spoiler of the next questions, I'm going to turn it back to Diane. Do you want to add to any of that, or go ahead and allow the group to go around the table, so to speak, and introduce themselves?
Sure. Yeah, I just wanted to add, since I came on as co-chair of this group, Rini and Anna and I have had several calls and conversations coming up with ideas for what to present to the group or what topics to bring to have meetings. But we thought this was a great opportunity to make it more peer-driven, as Rini said, to hear from everyone. We want to make sure that the information is relevant and interesting to the majority of the group. So that's what we're hoping to get today, is just some ideas on what everyone's working on and what you'd like to hear more about or see more from in this affinity group going forward. So with that, we're going to try to do this in an organized fashion. We'd like to go around the virtual table, have each person in no more than 2 minutes, preferably 1 minute. Just share your name, your organization, what your key funding priorities are right now, and if you'd like to share something about yourself that we probably don't know about you. So I can start if you want. I'm Diane Hagerman with New Jersey Health Initiatives. Our funding priorities are health in the broadest sense. Right now, the majority of our new work that is starting is focused in the southern 8 counties in New Jersey, but our work is focused on community collaborations, healthy communities, and really now looking at how data helps with how using data helps with decision making in small communities, like I said, in southern New Jersey. Something that you might not know about me is that I have completed several triathlons and a marathon, and you wouldn't know it by looking at me.
Oh, you're welcome.
That's my thing. So, Rini, do you want to go next?
Sure, I'll go next. I'm Rini Carniel. I'm Director of the Grata Fund for Senior Care. We're based in Whippany, but we fund in 5 counties: Essex, Union, Morris, Sussex, and Eastern Somerset counties. The 2 funding priorities right now are creating age-friendly communities. We're working with the Taub Foundation to fund a number of communities to become age-friendly. We have a conference coming up March 11th. We're about to fund new communities in this initiative. And the second area that we've been looking into and funding for the last few years is related to social isolation. So something some of you don't know about me perhaps is I'm beginning to learn about glass blowing. There's a glass blowing studio in Morristown. So I'm trying to take my art that I've done in some other areas, sculpture and watercolor, and learn how to be a glass blower.
Very cool.
Who would like to be next?
I'll go. I'm Pam Scott, Executive Director of Partners for Health Foundation in Montclair. My colleague Kathy is also on the phone, so I'm not going to share everything that we do, but I will say that our focus areas are all about health in the communities we serve: hunger and homelessness, healthy choices easier, seniors, needs of seniors, mental health, oral health. This year we're taking a closer look at DEI issues and trying to weave that more organically into our work. And I think getting the board on board, both to be enthusiastic and sometimes through education, is going to be an interesting path that we will pursue going forward.
Wait, DEI, can you explain?
Diversity, equity, and inclusion. And how that affects the communities we serve and leveling the playing field for all the people that we're trying to serve. Something that you don't know about me, you inspired me, Rini, because I've been thinking about this. I was very interested in photography when I was younger, and I had a 35mm camera. I did my own developing and printing of black and white photos, and I've been thinking about maybe getting back into that. So.
Hi. Hi, Burke can go next if that's okay. So the Burke Foundation was endowed by Jim Burke, longtime CEO of Johnson & Johnson. We are singularly focused on the healthy development of children and families in New Jersey. We have 3 pillars, so healthy births and pregnancies, early relational health, so healthy parent-child relationships, what's happening at home, and then our third area is high-quality early learning and care. We're happy to talk about any of our kind of big bets and investments in that area. I'll let Shiza talk about ACEs, but I guess one fun fact about me is that my 6-year-old and I are taking piano lessons for the very first time. Which is he's way better than I am, I believe.
Yes.
So as Atia mentioned, those are sort of our 3 big pillars. But one thing that we increasingly recognized was that we can't sort of make any impact in healthy child relationships and early child care and et cetera, if we're not focusing on the underlying trauma that many of the communities we serve are impacted with. So that's sort of the ACEs piece, the adverse childhood experiences piece, is a through line through all of our pillars. And so we're making, it's a really exciting moment for the Burke Foundation right now, working with the Terrell Fund and the Nicholson Foundation as a funder collaborative to really move this work forward. So high level right now, we're working on an action plan, a statewide action plan in collaboration with the Department of Children and Families. And that will really be a set of recommendations to move forward to address ACEs. We're also going to be hiring in collaboration with DCF, an executive on loan. Happy to send this group sort of the link to the job application for that person, but that person's really going to be acting as a liaison between the funders and the government to move some of these action plan pieces forward. And then as a final thing, we're also going to be holding in the spring an event with CNJG on the action plan recommendations and what comes out of it, and really sort of a menu of options that hopefully funders can get involved with.
Do you have a date for that spring conference yet?
I think we're looking at April for that, early April.
And Anna's been so helpful with trying to coordinate calendars. We're trying to avoid spring break.
Yeah, we'll send out save the dates shortly. But April, yes.
Thank you, Anna.
Okay.
Who wants
Susan. Should I call on Susan?
Just did, sure.
You can call on me. My internet was just a little funky there for a minute, so I was worried. So I'm with the Friends Foundation on the Aging, and our first priority is to provide grants to Quaker organizations that are serving seniors, and with a second area of serving the underserved in Pennsylvania, New Jersey, New York, finding that just serving Quaker organizations was a little too narrow when we wanted to make sure that we ourselves were looking at diversity, equity, and inclusion. One of our focus areas has been future leadership and how we encourage young adults to enter the field that they probably haven't considered through internships, fellowships, and so on, so that they're learning the values that undergird our work and consider the field. We've also done some granting in the area of loneliness and isolation this year, and as well as creative approaches to dementia care. The one I was stuck on was something you don't know about me, because everybody knows that I knit, because I knit in meetings. Everybody knows I'm Quaker, because that's unusual. I used to do a lot of camping.
Corinne, how about you?
Yes, I'm going next. Hi, this is Corinne. I'm a program officer here at the Russell Berry Foundation for about 8 years. We are a sunsetting foundation. I don't know if all of you knew, but we have about 10 to 13 years to go. And so when I arrived, we began reformulating our strategy for investing in the community. And as a result, we've developed a community strategy based on some learning that we did in the field. And as a result, we're very focused not on a specific population per se, although we do tend to look at seniors as a goal or a population that we want to kind of affect in some way because of the population that lives in Bergen County, but we're really looking at how to sustain and promote effective partnerships for systemic solutions in the community. And that involves seeding collective teams of planning for looking, for example, at how to develop resources that highlight what's not there in the community through like on Bertha or some other kind of technology tool. We're looking at developing community-based partnerships so that it expands from programming and giving programs to really engaging the community in developing those solutions. We just launched a couple of years ago a diabetes prevention strategy in one of the top age-friendly communities in Garfield, and we're in the midst of doing some of that work, and it involves seniors. And we've been looking to kind of highlight some of the work that some leaders are moving along, that are on the path of moving along to develop innovative solutions, but don't have the capacity for either planning or are looking for very seed funding to get those started. So that's the place that we're right now, and it involves anything from seniors to young populations.
Great, thanks, Corinne.
I can go next. This is Ashley. Sorry, I'm not on the video. I'm in open space. I didn't grab a conference room this morning, so hard to turn my camera on. I'm from Novartis and the Novartis US Foundation. We have just launched a new foundation strategy focused on health systems change or healthcare systems change, and looking through systems change and achieving health equity. We're very focused on addressing barriers to care, including bias within the health system and other barriers looking. So 3 focus areas. One is on bias, where we're looking at developing learning collaboratives to address bias within the healthcare system itself, also looking at education and diversifying the healthcare workforce. And then the second strategy is around digital solutions to addressing barriers to care, launching a new program with the Primary Care Association here in New Jersey, focused on bringing digital health to the federally qualified health centers. And then our third focus area is really captures all of our legacy work around supporting local communities and through primarily education and some healthcare work. So what do you not know about me? Let's see. I'm a twin. I guess that's always a good thing to share, because my twin lives somewhere else and most people don't know her. So, identical twin. She's a doctor. So.
Thanks, Ashley.
Sure.
Mary Eileen, have you?
Sure. I think I unmuted myself. Can you hear me?
Yes.
Yeah.
Okay. I'm Mary Eileen Forad. I'm with the New Jersey State Council on the Arts. And most of our funding goes directly to arts organizations and artist fellowships. But a lot of the issues that we're looking at are ways to connect art to community challenges. And we do this in a lot of different ways. We have a big focus on access, making the arts more accessible to people of all ages and abilities. We do a lot of work on public art through state construction projects. And we've recently developed a partnership with New Jersey AARP to bring the information about the arts that are available for caregivers, for respite, and for family members that might be homebound. We have a homebound folk art project. And we're looking at ways that the arts and health are related to military personnel, both active and veterans. So we're doing a lot of that work. And as far as anything that you might not know about me, I have 2 grandchildren, and they're about to go spend a semester with their parents in Costa Rica, where my daughter's going to be teaching.
Very cool.
Who has not spoken yet?
I think that would be me and Jackie. But we're like, you know, Partners for Health is on this meeting today in force, so I don't know how much you want to hear from all of us. I guess I would just follow up with, we're actually at Partners for Health touching on most of, in some way, on most of what you've all talked about. And Pam talked about our focus areas. One thing that we are trying to do that Diane mentioned is using data to inform our work, and we're undergoing strategic planning, which has turned into a rather long process, but we're trying to be really thorough and really set up structure and systems for the foundation moving forward. It's probably the first time we've actually done a real big deep dive strategic planning. We used to do what we called strategic planning light, and so we've never really done such a thorough job, and it's taking us some time. And one thing that we recognize is that as a small foundation that has a service area of 15 communities, there's no way that we can plug all the holes on our own in this local safety net system. And one thing that we look forward to, hopefully, is working with other foundations and like-minded organizations across the state. When we see these gaps in the safety net system, perhaps we could discuss them together and together decide on maybe some priorities to look at statewide policy to make changes and help strengthen the safety net in our local communities and across the state. So I'll leave it at that. And something you don't know about me, I don't know. I guess I like to bike and walk, and luckily for me, I could walk or bike to our office. So that's it.
Very cool.
Is Jackie on the phone?
Yes, I'm on video. Can you hear me?
Yep.
Yes.
Okay. So my name's Jacqueline Jafuni Kitsoris. I'm also at Partners for Health Foundation, so I'm not going to repeat what Pam and Kathy said. But one thing some people might not know about me is, despite my Italian and Greek last names, my mother's Colombian, and I did English was my first language, even though I was born here. So I was in ESL when I was elementary school and used to spend my summers in Colombia. And unfortunately, I've lost the language a little bit, but I am fluent in Spanish.
Cool. Anyone else on the call?
If everyone else is gone, my name is Jamel Washington with New Jersey Health Initiatives, and I'm not going to belabor. Diane's already elaborated on our funding priorities, but one interesting thing about me, I've done genealogical research and traced more than 125 members of my paternal family tree.
Wow.
I just want to take a quick, we have a couple people who are, it looks like, are only on the phone.
Looks like Marcy. Marcy, did you join? I see your phone is, it looks like it's muted.
We can, is that the 973 number?
I've unmuted it.
Is that, maybe not.
I've also unmuted the 609 phone number.
Hello, hi, this is Walter. I'm sitting in for Marcy.
Oh, good. Hi, Walter.
Hi, I don't know if I'll be able to be on for the whole time though, because Marcy has a sudden thing that she needs to go to, so I'm kind of just filling in a bit for her. But I have a lot of stuff going on here, so I'll stick on as long as I can. But I'm probably just mostly listening.
Okay.
Do you want to just share your name, the Healthcare Foundation name, and priorities of the foundation right now?
Sure. My name's Walter Meyer. I'm the assessment officer. I do some program officer things and other stuff here at the foundation. I've been here, I think this year will be 15 years. And our priorities are pretty. I think they're pretty clear. I mean, aging for sure. Public health issues such as violence, things like that we've done some work around. Veterans, we've been doing some work there as well. And health and wellness generally.
And something we don't know about you.
I'm not sure how much to reveal.
Go for it.
I'm a drummer, and I was in a band years and years ago, and we played a lot of local clubs in New Jersey and some in New York as well. Made a couple of videos, never got able to make a record or anything, but that's neither here nor there.
Great. Is there anyone else that has chimed in and not raised their hand or unmuted themselves?
I'm here, Rini. It's Julia.
Oh, good, Julia. So, Julia, we're asking everyone to name organization. What are your current priorities among what you're doing, and something all of us don't know about you.
Okay. Did you already speak, Rini? Because I won't cover things that you talked about that we do together.
I did, but you're welcome to share.
All right. Because that's really a highlight and a focus of our work is the Age-Friendly Community Initiative that we're partnering with the Grata Fund to support. 3 years have passed, and so now we're launching the next 2 years and planning our conference in March, which we hope you all can attend if you're available, to hear from some people from around the country and who are a little further ahead on this work than we are, and to hear also from what's been happening so far in Northern New Jersey. And we also have a focus on improving and increasing the workforce for older adults in New Jersey. That's still sort of an exploratory mode. We're trying to work with some of the local institutions like hospitals and universities to figure out ways that we can entice more students into the field and give them positive opportunities to learn from and to inspire them to work with older adults in some fashion. Not quite sure yet how that's going to look. It might be scholarships, it might be other kinds of partnerships with our local organizations to strengthen internships and things like that. And then just continuing our work in the aging in place realm of trying to improve the capacity of our local organizations and our coalition to improve transportation and housing. So we're working with the Corporation for Supportive Housing to do some assessments of the need for supportive housing in Northern New Jersey, and with a couple of other groups that are focused on various supportive housing issues.
So the other question is, share something about you that all of us don't know.
Okay. How much out of the box do you want to go with that? Okay, here's an interesting little fact. Since I like to study the lifespan, not just older adult, but from birth to older adult, Rini might know this, but my second of 3 children was born in the car. So, a very exciting start to life.
Didn't know that. Yeah. So thank you all. I think it's really helpful. It looks like we have some overlaps. We have some common interests. Looks like we also have some process common interests in terms of how people are looking at grant making and trying to improve their grant making. Does anyone want to expand on any of their issues that right now is keeping them up at night, either thematically or process-wise? And I figure we'll give this about, a few more minutes, and then we've got some very specific questions. And what is exciting is we're going to do a couple of polling exercises. But right now, is there anything that people are really concerned about that we might want to pay attention to and really get everyone around the table around, or many of us around the table, in the next 12 to 24 months?
So, Rainey, there's something that keeps me up at night, since I'm one of the foundations that's sunsetting, and we fund primarily in Bergen County. And Julia might know this because we've had conversations about this many times, but I think one of the things that worries me is that any type of initiative or program that the foundation wants to start requires a lot of community capacity to address some of these most system-related issues. And when I've been doing work in the community, I find that the groups that I'm working with really need a lot of support on helping move from collaboration and engagement to a sustained partnership. And so that's, I think, what ends up consuming most of our time, even with the Diabetes Prevention Initiative and how to work those issues. And so that's one of the things that we want to support. And we're thinking about ways in which we can provide community capacity or capacity building grants to be able to uplift everyone to do this work.
That's excellent. It's something I think many of us are struggling with. So that's a really a topic that I think I'm glad you raised. Others?
This is Susan. The thought that occurs to me, and sort of following on that, is that what happens when the grants run out? We are funding a lot of really exciting and interesting projects, and the groups that we work with work really hard to develop programs, and they're obviously meeting community needs. And then what? There's no magic state funding or federal funding or fairy godmother that steps in and says, well, I'll keep this going. So what do we do about that?
It's a really good question that we've talked about, not only what happens when the money runs out, but also what is our role as a grant maker when we end a grant? And we thought this might be a topic for the future to talk about how do you stay connected, or do you stay connected to your grantees beyond the funding? And what do the grantees want? What is, from their perspective, a good idea? And what is perhaps not a good idea? Where do they feel the funder needs to break away and let them go on their own without feeling perhaps that the funder is being heavy-handed or somewhat overbearing? So how many of you...
Right. Well, having served on the other side of that too, you know, it can be a lot of work for the funded organization to keep up with their current grantors, let alone ones who have given them funding in the past. I think they do come back to us when they're interested in receiving new funding. But I think there's been a lot of talk in the field about when we're placing burdens on the grantees who are stretched super thin. We know most of them don't have staff sitting around waiting for something to do. So, you know, I think there's sort of this false idea that if we just ask the right question or we get the right outcome numbers or something, that then we'll know what to continue, what not to continue, how well they're doing, and that we then ask more questions, make them do more reports or more meetings. You know, it just grows and grows, and I think we have to be really sensitive to what kind of impact we're having on our grantees.
Great. Others? Because that's a really, I think that's a great issue.
Yeah, sort of in terms of thinking about follow-on funding for our grantees, and I really respect what you're all saying, Susan, in particular. We're kind of launching these public-private partnerships for the very first time. And for example, we're looking at funding a universal home visiting model at birth, where every woman in a hospital system gets, no matter what income level, gets a visit from a community nurse 6 weeks after to check on the health of the mom and the baby, and then also look at a matrix in terms of thinking about what services does that family want and need, and then connect those resources over 3 visits.
It's been an incredibly effective program in North Carolina and a number of other places. We're working really closely with the state to think about where does this fit in with the existing home visiting structure. We are going to be funding evaluation and providing funding for that to really support kind of course correction, building a logic model, thinking about results. And I think my sort of question and thinking about talking as a group from the get-go is how do we build that really solid relationship with the state, learn more about Medicaid, which seems incredibly complex, and other braided kind of funding sources, so we can really support our partners to be on track for that government funding.
So I would like to add to that, and Diane and Rini, I don't know if now's the time, but part of our work in our strategic planning was to do some benchmarking with other foundations, and we spoke with a foundation in Pennsylvania who was one of the founding funders of a Pennsylvania Health Funders Collaborative. And so they have 40 some odd members that are all health conversion foundations from across Pennsylvania, mostly smaller foundations, but not all small. And they meet throughout the year and they prioritize the issues that they're hearing about, and they connect very deeply with the government officials throughout the year. They know the cabinet members well, they learn about the systems, and then they learn about what's going on in their communities or wherever they serve. And then they meet with legislators and talk about the issues and talk about how to change the funding streams and improve the safety net. So, and again, Diane and me, I don't know if this is the time to bring this up, but it was pretty amazing what they've been able to accomplish over the years. They've been doing this for about 11 years. And then they also pointed out to us that Virginia is starting that same kind of process and starting to meet together. So I think what we're all seeing is that our grantees and the safety net providers are, in a tenuous situation at best. It's a really fragile safety net. I think we're finding out more about that just in the past couple months in our service area. And the future is not bright. How many people have said they're from sunsetting foundations? I mean, what are we going to do with when even the supporters, the philanthropic supporters of the safety net are gone in 10 years? So I think there's a lot to discuss, but I think together we might be able to make an impact. I'll leave it at that.
That's a really good area. I think there are a number of ways to go, and Diane and I did speak to the folks who are part of this Pennsylvania group. There are 45 members, what we learned. And if it's something that interests the group, it may be something we can have them speak to the whole group, because I think you're right, they've learned a lot. And there may be ways we can see if this is something relevant to this group, if that makes sense. At the end, we'll be doing some polling and perhaps that will come up. Anyone else? Anyone else want to talk about what's keeping them up, or how we can, as a group, perhaps collectively look at some issues together that resonate with everyone? If not, I think one of the things we also, Diane, do you want to ask about collaborations?
Sure, and this kind of, from my perspective and from NJHI's perspective, this kind of merges the last question and the next one. So my question is there anyone who's already collaborating with other funders? And we know a lot of you are, and you've talked about it a little bit already, but collaborating with other funders on one or more of the issues identified or on other issues. And I think, so I'll just give an example of what we're doing at NJHI. We're working with the Community Foundation of South Jersey to bring in a model focused on community-driven decision-making on health issues in a community. And it's a model out of Vermont called Heart and Soul. It's out of the Orton Family Foundation. But the spin that we've put on it is each of the communities that is selected to participate in this initiative will be left with an endowment in their community, so that they will decide, working with the community foundation, of course, where the money will reside, how residents decide how the endowment dollars are used in their community. So that's something we're exploring, just starting to dip our toes in the water of kind of democratizing philanthropy and putting the money in the community's hands, not giving them all of our grant money, but really making it a community decision on how they can use dollars the best way. Because we know we've done this for a long time. We've come in and said, okay, here's the issue we want to focus our grant funding on, but it might not be the most important and critical issue in that community. So that's something that we're working with, one of the areas we're working with another funder on in the state.
When we did the benchmark, sorry.
Oh, I was just going to say, I went to the environmental group meeting through Council of New Jersey Grantmakers last week, and that came up loud and clear from one of the local organizations and from the Ironbound, you know, that their funders come sort of drop in from above and say, you must work on this. We have this technical assistance to provide. We must do this. You know, you must do this. And she said, we know what we need in the community. We have really strong ties here. We don't need you to come in and tell us. We know, you know better. I mean, she didn't say it in those words, but that was she almost said it in those words, but she was very impressive and powerful. But anyway, just sharing that as a follow-up to your comment, Diane.
My comment was going to be a similar follow-up. This is Pam from Partners for Health. When we did the benchmarking that Kathy mentioned earlier, when she spoke initially, we heard from several other funders across the country who are very intentional about getting feedback from their, not just other grantees, but the community members who are being served, and having them be part of, you know, really figuring out what the best solutions are and getting them engaged in that work. So I think it's something that is something where I'm particularly interested in and mindful of as we think about our path forward.
I would also add, maybe Shazla, you can kind of share what happened, but we've sort of learned a lot working with Nicholson and Terrell on kind of some of our bigger grant projects about taking some time at the upfront to really talk about coordination, governance, decision-making, reporting templates for our grantees to really harmonize our process and not be burdensome. So then maybe, do you want to share what we just did?
Yeah. And so the idea, as Atia mentioned, is, you have 3 different foundations, all with different sort of operating procedures, templates, things like that. And so the idea was, from the onset, how can we streamline communication for the grantees? So that, for example, out of the 3 foundations, one of us is the funder lead, and that's sort of the main person that the grantees are communicating with. The funder lead is responsible for consolidating decisions in the funder's end and then communicating it. So what it sort of does is create this like really streamlined communication vehicle. The grantees are notified of how to use that, and the expectation is clear, and there's a clear decision-making structure within the foundations and then how to relay and communicate that back to the grantees. And like Atia mentioned, we've streamlined both the proposals and also the quarterly reporting templates, the calls, and all of the little sort of different unique structures that the funders have. We sort of consolidated them to make it easy for the grantees.
And the nice thing is, then they're also, with 3 funders coming together, they're kind of almost accessing $500,000 a year. So it's a nice way for them to get, they're not going door to door to each of us around getting proposals.
So Diane, I will say that for us at the foundation, we've gone into the field with the idea that we don't have a prescribed, that's why we don't have an umbrella of work. We go as partners, and we do kind of think about, as you're developing partnerships, really kind of figure out which ways is our funding more helpful to the community. And so that means discovering that they have a grant for community development and that our funding might help push an element that they wouldn't be able to source anywhere else with a seed of a project. And so we, in some ways it's difficult because I hear you all being very focused, and we tend to take the approach of more letting the community figure out how our funding can help them move forward. And sometimes that's really funding the things that are soft. So they might have an opportunity with a federal grant or a local block grant for some sort, but nobody's paying for planning. And so these people are expected to come together and roll up their sleeves and make that work. So we're willing to say, we'll provide the funding so that you can have the space, the mental space, and the opportunity to work around this plan more collectively. The same goes for the community health needs assessment. We're not going to say, oh, so we identified that now you need to develop a project around this because the community health needs assessment says so. But more saying, what is an issue that you're struggling with, that you feel that if you had some funding, you will have the mental space to do some planning around it, and let's figure out from that perspective and see what comes out of it. And so it's some way, in some ways it's harder for us because then it's difficult to kind of say, well, what are we driving towards? What are we measuring? But we do have a logic model for the work that we do that is very broad. And so in some ways we're creating the legs of the table to uplift whatever is going to go on top, rather than figuring out what kind of pieces do we want to put on the table. So I like Diane's approach with the community soul, because it does allow community groups to also align their health priority, or even if they're looking for a specific population that they want to affect, based on what's already, what there's appetite in the community to drive towards. And that, it's a big win for moving things forward versus trying to kind of incentivize people to come to the table around an issue that you care about, but people might not be there yet.
I just want to go back to, thank you, Corinne. And I think it's, that's something that we were intentional about probably about 5 years ago, is putting more funding toward the planning before the implementation, because we've tried it both ways. We did funding that was for all of the planning and stopped at the implementation. And a lot of our grant making had always been for the implementation without really giving consideration to, is there a solid plan for how to do this? And even I love what, Atia, what you guys were talking about even as funders, making sure you do all that planning up front before you actually launch into this initiative, and it just causes mass confusion every step of the way. I wanted to go back to the chat too, because we've had a couple of comments in the chat. One was from Craig, Craig, you didn't introduce yourself, at the Council of New Jersey Grantmakers, talking about participatory grant making is one of the buzzwords this year, which is something super exciting. And like I said, we're just starting to dip our toes into that water. And then Susan brought up a comment about universal applications for grants. And I feel like we've had that conversation in years past in the council and maybe tried it. I'm not sure, some funders. I can say, NJHI is part of the Robert Wood Johnson Foundation, so we have a lengthy application process that we're always working to try to streamline. But I didn't want to, in case people aren't looking at the chat, I just wanted to bring that up to see if those raised any thoughts as well. And does anyone else have examples of how you're collaborating with other funders, or how you've, done it in the past and it hasn't worked?
So this is Rini. I'm going to add that the experience of working with the Henry and Marilyn Taub Foundation has been really a learning experience for us and for the council members. I think, again, what you said about funding planning is something we'd never done before, when actually the group was against. We've turned that around, and the value of some thoughtful planning is something that the group is now embracing and recognizes its value as we do this again for a second cohort. Secondly, I think that we've funded on a year-by-year basis, and we're trying to fund groups for longer than 1, 2, or 3 years, and that learning together over a longer period of time is something I think we're hoping to see what that achieves. Because what we're hoping to do is exactly the question that was raised, or how do we take partnerships that have been created and make them sustainable, committed, ongoing partners, not just at the table, but people that are willing to put time, money, and talent going forward. So as we do this age-friendly work, we know it's going to take a long time. We're looking around the country and seeing that many communities are in 8 to 10 years now into this. And as a funder, we know where we start, but where do we end? And we've changed, as I said, how we've started. So that's been a significant change. We've also added an evaluator in the mix, which as a single funder, we would not have the capacity to do. And I think having an evaluator chronicle the progress in this work has been a real learning experience that I think we've added to. I'm glad to hear that others are looking at bringing in evaluators.
You know, I also think it's interesting that a lot of people are talking about systems change. And although we haven't finished our plan, we kind of borrowed a statement from the 100 million healthier lives folks. And it's been really helpful because it's stuck with our board, and they'll say to us, "What's that question again?" Even if they don't remember the question. But we had some guiding questions, and the first is, who's not thriving among us and why? And then the second is, what's changed because we've been here? And that could go for an organization that's doing the work or a funder. And then we've added a third one, which is, what would remain if we had to walk away tomorrow? And it's been really helpful when we look at how we're going to move forward on any issue when we think of those 3 questions. So I just throw that out there.
Could we get those questions? I wasn't typing them, but they were great.
Yes, can you share those with us and we'll send those out?
Sure, and the thing is, they stick. You know how sometimes you work with the board or an organization, have these really long things, and people want to keep adding on, and then you can't remember them for the life of you. But because they're so simple, they kind of stick. Yeah, we can share. And again, they're not ours. We borrowed, except modified.
So I think, is there anyone that would like to kind of raise their hand and say, I've got an idea, or any experts or innovators who they'd like to hear speak at a future meeting? We've thrown out a couple. Kathy, you just mentioned something very interesting. What are your thoughts? Diana, please. Anyone want to start?
I really love the idea that Kathy had of the group in Pennsylvania and what they're doing in terms of bringing foundations together, and then prioritizing and then developing those deeper relationships with the state, because I think that would be fantastic. Also want to put a plug in there for, I think you guys have done a great job bringing in commissioners to work with, do the CNJG kind of talks quarterly. Love to hear from the Medicaid director, and maybe for you all, Medicare. So just thinking about health and aging.
Mm-hmm.
Great.
And to that point, just with your ACEs work, I think if we heard from the Pennsylvania funders and then heard the way you're working with an actual department within New Jersey, with a multi-funder group, that could be an interesting way to hear how one project in New Jersey is going, and looking for a statewide action plan. So I think we can build upon what some of us are already doing, and anyway, be more effective and be more systems oriented.
Kathy, when you spoke with Russ about the Pennsylvania work, did they address at all how they narrowed the topics they would bring to the legislatures? Because everyone covers so many different things. Just wondering if that's part of their discussions or something we'd need to focus on going forward. or Diane or Mimi, any of you, if you have any thoughts on that.
I don't think they went into depth on that. You know, we weren't on the phone with them all that long, but I think it would be great if they could come to a meeting and we could ask all those questions, or even have some questions before they came, so they would address all those things in a presentation. And the other thing is, they have been at this for 11 years, so they've learned a lot. I also think it would be great to touch base with the foundation in Williamsburg that they mentioned, because they're just starting out. So they'd be a little bit ahead of us, and we could see how they're approaching it and maybe continue a relationship there.
So I think that is a big part of it. They have been at this for 11 years. They have 2 identified kind of spokespeople, or 3 that have keep getting the ear, because they've collected some of the data in the state. They're getting the ear of legislators, and now legislators come to them for some of the data. So I think that was something that I learned from the call with this group. And again, that took some time to create that relationship, but it's something that might be really helpful for us to do. On another vein, along with the Henry Maryland Town Foundation and the Community Foundation of South Jersey, the New Jersey Foundation for Aging, and AARP, we're working on bringing age-friendly efforts to the state, to the governor, and putting some various partners that have interests in changes in the build community and other areas to try to think of what targeted policies we want to bring to the governor and to the legislature. And I think that collaborative work is really helpful. And I think learning from what PA has done will help move this work forward. Julia, do you want to speak a little more about that?
Sure. So yeah, I was going to mention that work. And I think the way to answer the question that was raised, the way that we're approaching this statewide collaborative, which is difficult, as you know, even with 3 foundations working together, it's tricky to arrange meetings, to, you know, agree on your process and sort of become a united group. Statewide work is even more complicated. So what we've decided to do is put out an RFP for a person who can help us guide this work, who can sort of run a one-day symposium sort of workshop, not a conference, but a day to put together a working group, so that we can start between now and then. The person that we hire to do this work will do research, will think about the kinds of decision-making bodies in New Jersey that we should be approaching, what kinds of legislation should we be looking at, or if we should at all, if there's some other way to move forward, and collaborating with other states around the US that have adopted an age-friendly model to see how they did it, and figuring out how that might look in our state. So the RFP will be sent out to probably a team of people will apply. We're sure to tackle this this need that we have, but we figured that would be a good way to sort of move ahead deliberately and decide what this group should be doing together. So, you know, it's part of a planning process, exactly what you were talking about before, that will hopefully get us to a place where we can form a working group that has a significant and specific goal that we're trying to reach together.
And what's really exciting about that is that a funder within the Community Foundation of South Jersey has provided some funding to help move this forward. So we're really excited that this is something that not only is this group interested in, but there's some funding to help make this happen. But as we get the RFP finished, if anyone has any suggestions of who to send the RFP to, let us know. So I think that would be really helpful. Other collaborations or thoughts about collaborations or issues related to collaborations anyone would like to bring up?
Do you all have, I mean, is there like a list where we're often looking for strategists, facilitators, evaluators, yeah, like just sort of like a value-added services that we can contract out for our grantees. Is this a network that we can maybe go to get suggestions? You're nodding your head.
Yeah, we're waiting for you.
So
yeah, I think we're always looking for like fundraisers
yes,
for our partners.
Yes, using the listserv is a great way to inquire from this group of who you're working with for evaluators, who you're working with for any other kinds of programs or products or people. Yes, absolutely use that listserv to query everybody in this group, because there's way more people on the listserv that are on this call.
Other topic, I know the topic of data was raised by a number of people, and how to be more intentional in looking at data in terms of using that for strategic planning. Is that something that resonates with the group? And does anyone have any thoughts of an expert or a panel that we could put together to talk about this issue that would inspire all of us?
We, at the Burke Foundation, we ended up doing an RFP process to find an evaluation capacity building partner for our grantees. And the first thing that they do is a logic model with every one of their grantees, and it's very very participatory, and they do a really nice job of really listening to our partners about what their needs are, what is their capacity, and then coming up with the logic model, and then a really smart kind of data evaluation plan, so it's not so overstretching. I think often with health in general, you might be looking at an outcome, but it's pretty hard to measure something that may be something that happens 5 to 10 years later. So we'd be happy to help support this if you're interested. It's from Via Evaluation. They're from Buffalo, New York. They're really, really good public speakers, and they could do a session around building a logic model, working with grantees, data and evaluation, and be pretty compelling if that could be helpful.
So our foundation is looking into this issue of data, and I know that my colleague Naomi, it's working with Craig and Anna on this front. But we've been looking at data in a much more system change approach for helping communities understand their needs and their priorities versus a particular issue, especially because when you look at social determinants of health, data might not necessarily come from the health field. So you might be looking at economic development, or you might be looking at education outcomes. And so it all melts together. And so in some ways, we're looking for more of the transformational approach to data to bring people together to look at an issue that might be cross-sectoral and understand it from their specific viewpoints. And so we brought a group of funders here in Bergen County to look at the model that was implemented in Texas, Molly Cox, which they have this community indicators project, which is able to bring a sector of nonprofits, both from education, economic development, housing needs, primary needs that any one person might be faced with in the health folks, to really look at how the community is moving towards some indicators and track back if they're making impact, if all of these foundations and these investments that are being put in the community are really making an impact. And then figuring out what populations are, back to what Kathy said, who is not thriving around us, but that's really driving from the community data. And so, a lot of people look at the county health rankings, but zip code specific data sometimes is missing. And so it's really bringing it from a county level to a very, very specific level by neighborhood, for example, so that you can really see where people are residing and what are their health needs. So I think we're launching a group to take a look at that, at least in Bergen County, because we know that's an issue, but we'd love to see that being implemented elsewhere. And some communities are farther along in New Jersey around this because they've had some investment on this, and so we're happy to get the process started and even invest if there's a viable path forward.
Yeah, and I'll from at NJHI, we're just launching an initiative, and when we're talking about data, it's similar to what Corinne was just talking about. We're thinking about data even before they're doing the work and measuring the impact of what they're doing, but using data to make those decisions. So we're working with the folks from City Health Dashboard who are at NYU, and they've done health dashboards for the 500 largest cities across the country. But we have them now using the similar model of that dashboard, but going into very small communities in South Jersey, communities of 2,000 residents in one of the communities. And I can share with you afterward a list of the communities that we'll be working with. First of all, to see if they can develop a similar type dashboard and get the same kind of data for such a small community. And then working with the partners in that community so that they can better understand the different sectors and the different needs, and thinking about housing as a health issue and education and income and employment and all of those different factors that we talk about all the time as affecting health. But when you get into a really small community, they're not looking at it as broadly as you would think. And that's one of the things that we've learned through this process, just trying to bring on 10 small communities, is the lack of capacity to even be able to participate in an initiative like this. So we really want to see what we can do. We've been at that moderate sized community level. We have coalitions across the state that and like Corinne said, that use the county health rankings, and a lot of the data sources out there are at that bigger level. So when you get into a small town or a census tract, we've got all different size grantees, the data becomes much more scarce to look at, to make your decisions and really start planning for what you really want to work on. So it's very new. We're doing this whole process, I keep kind of saying backwards. So normally what we do is put out a broad call for proposals, people apply, we do site visits, we announce who the grantees are, then they start doing the work. This time we invited communities to do a readiness assessment to participate. We've identified the 10 communities, and now next month we're going to bring them together at what we're calling a co-creation event. And that's when they will start working. They'll get their dashboards from the City Health Dashboard people. They'll use that. We'll have experts in the room, and they'll start working on their grant application at that point with us. So we're working with them to develop their application to really make sure they can make the most of this funding. So it's new and different. We're not calling it a pilot, but we really are testing to see if this works. And if it does, in these 10 communities in South Jersey, we hope to be able to go broader across the state as we roll this out. So yeah, data, we've talked about it a long time about evaluating the work that our grantees are doing, but we thought we need to put it all at the beginning and start looking at data to inform those decisions before we start asking them to measure how they're doing the work that they're doing.
So it sounds to me like we've got two different directions we could do data from the beginning and related to capacity building, and data from the evaluation and systems change. Are we seeing systems change? Is very interesting. Julie and I are working with Rutgers, and one of the methods of looking at data we're thinking is very helpful is to look at the ecosystem in which a grantee is working and the areas of change that the grantee is trying to make, and be able to plot that for the grantees as the projects develop, so they can begin to see how to secure those partnerships, perhaps larger and larger, and perhaps what's not in their network and connections, and not have what happens with some is kind of parallel spheres or silos of how they're connecting, but the agencies that they're working with aren't connecting with each other. So the network concept and the ecosystem concept, I keep hearing in other areas, and I was really glad to bring that in. At the same time, we're using the success equation, something that was brought to the Council of New Jersey years ago, I guess, with Jason Saul, and work on, rather than just looking at a logic model, helping the groups think about what is the success they're trying to achieve and work backwards with metrics and then develop strategies. So is this something we think we could pick up and really have sessions with experts? Sounds like there's some experts that y'all know.
Yeah, I also want to add just to your point, Renee, we're working with Merck for Mothers and a number of other collaborators around maternal mortality. And they've hired the group Greater Newark Healthcare Coalition is the grantee, and they've hired Leslie Cantor at Rutgers. And it's a really innovative model where they're actually training community members around participatory research. And those community members are going to go in and actually talk to African American women about their pregnancy experiences and really kind of probably test a lot of assumptions that we have and challenge them to really understand what's going on at the ground level. So I think it's a neat way.
They're setting the learning agenda, the questions. They're also conducting the focus groups, as Atia mentioned, and then also they're doing the analysis. So really sort of from the onset and throughout the entire process, this sort of role of community research and participatory research.
That sounds interesting.
I love Leslie.
Yeah, that sounds really interesting.
So I think Leslie, a Rutgers presentation with some of the Rutgers experts might be great along with others. Does that resonate with people?
Sure.
And also the council right now, I'm looking into doing more of a broader skill-based program, like a large skill-based program with multiple funding communities just around evaluation in general. But I mean, I don't know if there's specific things that the health and aging funders want to focus on with evaluations that would warrant its own program too. Or maybe looking at a specific case study. So that's just something to think about.
Okay.
So
another question, sorry, go ahead.
Go ahead.
So another piece of our ACES work is a public awareness campaign, really sort of the statewide education campaign to educate people on ACEs, but then also provide key populations. We're thinking like law enforcement, healthcare, and education to start, providing them with the toolkits to address ACEs and trauma. And so part of that, thinking about sort of data with that, something as big as a public awareness campaign, curious if anybody on the call has experience with different metrics we could use to make sure that the campaign is actually sort of reaching communities and some innovative ways to measure data, and sort of what are those key things we should be looking for beyond just sort of engagement in social media and things like that. Like how can we sort of measure the change and the awareness that we want to see in the community?
I think measuring awareness is always hard. And so the closest thing often is where awareness has been displayed and doing some infographics about the different places where the publicity has been made available. Because of social media, it's such a new area, and it's really, some of that is what else gets shared, what else, but it is a very hard area. Anyone else have any other suggestions?
Well, we haven't done it directly, and I'm sure you guys are going to know when I say Public Good Projects does amazing work.
Good. Yeah, that's great. Yeah,
Yeah.
We're talking to them.
Yeah. And we'll survey the listserv as well for other agencies that you may recommend working with.
Yeah, I've always been a fan of their work.
Great.
So we're getting closer to the end. I'm going to turn this over to Diane. I know we're going to do a really cool polling exercise.
We are now?
If you would like, unless there's something else you would like to mention first.
Well, so there was, this conversation started at the beginning, so I feel like I'm stealing your question off of our list.
It's okay. I think I stole yours.
About what happens once the grant ends? And is this, I don't know if this was the polling, but I think we kind of got away from that. So, do you stay connected with grantees after the funding ends? How do you do that? Or feedback you've heard from grantees. I know when we were talking about this in planning, we started when we kind of shifted our grant making, went to this more collaborative process and funding collaborations rather than funding an individual organization to do a specific project or focus on a specific issue, we started doing communities of practice. So we do a monthly webinar, kind of like this, that in the beginning started more as a way to help with capacity building and delivering content and skill building. But now, 4.5 years later, has turned around more to, you know, what's been happening in the work that you've been doing and what can you share with your fellow grantees and us that we can share more broadly. And while some of the grants we funded in 2015, actually the cohort that we funded in 2015 ended, those grantees are still part of that community of practice. And we are thinking about how we keep that going, because we have another cohort of grantees in that same area of work that their funding will end this summer. And we have a different cohort of grantees that we do a separate kind of community of practice type thing that we're looking at how we blend them all together and continue doing that, even though we're not funding those communities anymore, because our vision for this work was that once our funding ended, the collaboration would continue. They developed plans that some of them went out, you know, even though they had 4 years of funding, their plans were for 10 years, you know, 4 years, 5 years, 10 years or longer in their community. And we want to make sure that while they might receive different funding from NJHI, that we keep that, building the network among those organizations and those communities across the state was really important to us. And we want to make sure that network remains. So that's one of our ideas of how, after the funding ends, we can still provide some kind of capacity and support to the communities that we've been working with for the past 5 years.
Right. Does anyone else have any other examples of what they are doing with their grantees after the funding ends, the grant cycle ends?
Diane, I don't have a specific example of my own, but I think that is a great way to keep people connected and acknowledge the value in the work that they're doing. I have heard that from another colleague, that's the way they followed up with their age-friendly community work, was to continue to have periodic, I don't know, maybe quarterly meetings for people to attend together, and that people come to them eagerly because they enjoy the peer-to-peer networking and the sharing of lessons. But they also set up something that is like an accomplishment, a range of accomplishments that towns can achieve, and you can strive for, you know, a silver, a gold, a bronze level age-friendly community work. And people, I would, if asked, I would have to say that there is no money attached to it. There might be a small amount, but it's something that people are engaged in. It's kind of like any other, like a scouting sort of model where you get a pin or a patch. It's something that people like participating in and comparing notes with each other and striving to reach the highest level that they can. So I think just keeping people networked in that way and bringing in speakers that they might, you know, ask for or would appreciate learning from is a great way to keep the work going. Even if you need to put in the money for, you know, providing food, providing some transportation for people to get there, whatever it is, I think keeping the network going is a way to continue the impact of the grant making. And actually, I wanted to just circle back really quickly to the question about data and just put this out there in case anyone has not ever looked at it. Since many of us are focused on overall community health and social determinants of health, one of the sources of data, it might not go into as great a detail as you would be looking for on certain health issues, but AARP has this great livability index, and you can go on their website, livabilityindex.aarp.org, and you can just put in, we were talking about getting down to the community level, you can put in your zip code or the name of the town you live in, and it will give you a total index score, but it's broken down by housing, the neighborhood that you live in, how transportation meets people's needs, the environment, the quality of the air, and many other things. Health, it talks about prevention and access and quality. It talks about civic engagement. It has all these different dimensions that they rank your community on, and then you get a score. So if you haven't ever looked at that, I think it would be something worthwhile. And it's interesting to dig in a little bit to the data that they pulled to get those scores. and see if some of that might be a way to unify our work if we decide to, you know, do something more collaboratively.
Thank you. We'll try to share that website in the chat.
So it sounds like there's some interest to keep working more collaboratively. Is that by a shake of heads? Is that something that people would be interested in terms of learning ways we can do work collaboratively? And in particular, I think the concept of working collaboratively and then working toward communicating a better relationship with at the state level. Is that something that I'm hearing by a shake of heads? I guess I don't have the reaction button. But great. Are we missing any comments before we take a couple of polls about future meetings and topics? Anything else anyone else would like to bring up?
I would actually, I was just thinking, like we talked about a whole bunch of different things, but we also talked a lot about process and gathering data and ways to work together for our grantees. I think that we would be wise to do that for the group also, like our group. So, you know, ways to communicate, maybe some guidelines. And again, if we listen to the Pennsylvania funders, we could possibly learn more about how they did all that. But I think before we jump to different topics, we might consider the ways and the processes by which we might be able to work better together.
Kathy, better together among us, or among us and our grantees, us as funders and the grantees. Can you clarify that?
Sure. I mean, us as funders, rather than going to evaluation topics and all these things. I mean, I think they're all really important, but I think if we're going to talk about working at the state, and maybe we need to, it won't happen in one meeting or whatever, maybe it'll take 6 months and we can just continuously think about it, but how might that work and what might we need to have in place to do that? I don't think all of a sudden, just because we get on, I don't mean to sound negative, but I just think we're talking about doing this for our grantees to set the stage on the front end and gather data and think about things and be thoughtful. I think we as funders would have to do the same. What's good for grantees is good for us, is what I'm saying.
Yeah, we in our early childhood, early years funders collaborative, but so it's you know, Todd's part of that, Nicholson. We have we've all, like, there's just a chart of what every foundation funds, when is their RFP processes, just kind of like getting, is that sort of what you mean, Kathy, like getting ground level what we all do, so we have a kind of sense of what our own internal processes are to share with everyone.
Yeah, and I think you know, the meetings with cabinet members are great, and we learn what their priorities are. I think if we knew what priorities were of the different commissions across the state, you know, that might prompt us as to what issue areas, like what we're saying, what should we, how should I say this? There's so many things we could be working on, and there's so many things we already are working on, but what's primed for action, right? You know, and where would there be the greatest cross section to start, and where are there actual opportunities with policy work? So not only talking to the different commissions, but there are different advocacy groups that work statewide, right? Mm-hmm. So what do they see? They're already in the field, mm-hmm. and they might know what's primed for opportunities, so they could help us. Mm-hmm. And they're talking to people with learned experience and bring a lot to the table. So we don't have to start from scratch, but I think if we put some thought into that and then talked about us, I don't know. It's like a Tuesday morning, but it's really after a holiday weekend. Tuesday morning, so.
I agree with Kathy, because I think what ends up happening with some of these groups is that you end up talking about everything and nothing. And so it's also, what is the utility of coming together? If we want to advance something at the state level, it requires some collective alignment of what we're all searching for. It can't all be our singular priorities, because that's not the state doesn't function that way, can pay attention to so many. So I think even aligning what we think it might be a first priority to tackle, and we might have many, might be helpful process for us to kind of all drive towards the same outcome.
Mm-hmm. Great. I think that collective alignment is really important, and also to understand from the other direction, what are some opportunities that perhaps we can learn about from some of our folks that know what's happening on the Hill that are happening, because I think that is a problem. We don't always know what's happening on the Hill, but some people do. So that's a really interesting point. Now, I hate to be the bearer of 3 minutes to go, but I'm going to turn this back to Diane, and then we will thank everyone. But go ahead, Diane.
So first, I've had a lot of thoughts, and Rini's been talking about these cool polling options, and now I have a lot of ideas. But we did want to just gather your thoughts on meeting as this group. We did today as a virtual meeting for several reasons, because it's easier to get to. And if it had snowed today, we would have, and we had a physical meeting, then no one would have shown up. So we're just going to ask a quick questions about where you would be interested in meeting. So let me make sure that I do this right. So there's the whole question. We'll have another day for a divisive conversation about, is there really a Central Jersey? But so yeah, if you can just quickly pick where you would prefer, and if you would be willing to host, you could chat in, what city or where you would be willing to host. I can't answer the poll, so South Jersey's got very little representation right now.
And I think the other is offline, if there's a particular area, such as there's certainly been a lot of talk about the Camden Coalition, if we can perhaps convince all of us to drive south for a special project, is that something we would consider? And I think an offline, please, or just by a shake of hands, I think that's another area that I think some of us would like to learn more about, certainly getting more and more press. So that's another thought, and certainly put that in the chat.
Yeah, so any thoughts you have, put them in the chat.
We have a volunteer, yes.
And I think maybe
just to add to, would love to hear more about the regional health hubs. We're beginning to invest more in them. That Camden Coalition, the Trenton Health Team, Greater Newark, and the Passaic one. They seem really, really fascinating in terms of their healthcare work, and then the community work and bringing that together.
Okay. And I know we wanted to do a poll on, the topics we talked about and where everyone's interest was in those. So maybe I'll talk with Rini after this call. Maybe we can do that afterwards as a doodle poll to get everyone's input on topics. And if you think of other speakers after we end this call, then you can put that in there.
Again, just so glad that everyone participated. Thank you all. It's nice to catch up. It's nice to hear your facts, the unknown facts about each of you, and hope to continue hearing about photography and running and other things. Glass blowing. And for those that are grandparenting, I'm certainly in that league now. Craig, you didn't get to tell us an unknown fact about you. Did you want to chime in as a concluding comment?
Sure. Everyone in my family has the same initials, including our dogs.
And so we have the results of the poll.
Sorry.
Okay.
And I have a few just concluding wrap up. So I took lots of notes. And I know there were a few requests for information, like the questions from Kathy and some other information. So I can follow up with that in a separate email to everybody, also with a list of participants. So that way, in addition to following up based on this information with our own programs, that would be helpful. You can also follow up with each other if you want to reach out, if you're interested in something specific somebody might have said. And then in addition, I just will mention that We do have an upcoming webinar on participatory budgeting with a participatory budgeting project. It's a little different than participatory grant making, but it's still the whole concept of, inviting the community to engage in your grant making process is still there. So if you're interested in that, you can register on our website. And then Craig also said that any jobs available can be posted on the CNJG website. So yeah, those are my concluding thoughts. Rini, Diane, anything else to add?
Thank you, Anna, and thank you for all of you participating. It's just nice to connect. This has been a really nice affinity group, and I think again, inspiring as we hope to achieve. And I hope all of you felt this was a beneficial call, and look forward to getting together again.
Thank you. Thank you, everyone.
Thank you.
Bye.
Bye.